This 3-minute clinic is all about the initial stages of rehabbing an Achilles injury. Now, a lot of times it could be Achilles tendinitis or tendinosis. There's some inflammatory process going on in the back of your ankle where that tendon gets really hot, swollen, puffy, that kind of thing. The last thing you actually want to do when that's occurring is pop back and go into one of these calf stretches. Because a calf stretch has the ability to compress that tendon. And when you compress it and you lengthen it, it has the ability to actually irritate the tendon more. And so we want to actually prevent that. In fact, we want to prevent lots of movement in that ankle, especially with load. So what we want to do is introduce isometrics to that injured side. And so to do that, it basically means we're going to be creating a muscle contraction without movement at the joint. So if we think about our bicep, it'd be like me pushing down and pushing up, and my bicep is contracting, but I have no movement at my joint. The same thing is going to be going on at your ankle. Now I'm just going to get this pole for a little bit of help with balance. And we have a step here, and you're going to go up with both feet, and you're going to keep your heels even or level with the step. We don't want to drop them down, and we don't want to hold them up yet. That's a progression. For right now, in these initial stages, all we're doing is holding even with the step level. And as you get better at that, you work your way up to maybe 10 sets of 45 seconds or 10 reps of 45 seconds. You can take that other foot away. That's about twice as hard. But your calf works, but you're not producing that pinching movement in your calf. So the next thing we're going to do is we're going to add a little bit of movement above the ankle, but not at the ankle. So we're continuing to maintain an isometric hold at the ankle while making the rest of our kinetic chain work. And so you're going to step back, and you're going to keep your heel same level as the step, and then step up. Step back, and step up. And you'll see that by stepping back, I maintain a vertical shin, and then when I step 2, the same thing happens. I'm not going here and putting dorsiflexion into my ankle, which once again compresses that Achilles tendon. So for these, you want to start with just about 5 reps. Maybe 2 sets, maybe work your way up to 4 sets of 5. And then you can start progressing to 8, and 10, and 12 until you can build your endurance of that muscle. And you're working for about 45 seconds on that leg. Once again, that 30 to 45 second range allows you to get a little bit of an analgesic effect or a pain reducing effect in that tissue. And so those are 2 beginning exercises when we're starting to load up the Achilles tendon that prevent pinch and possibly irritating that tendon more. So this was today's 3-minute clinic.